Hi, everybody. We're continuing to work on our frequently asked questions program. So hopefully we're giving you some frequently asked answers. Today's question is, how can we develop an effective treatment plan based on an initial visit? And I would like to say that we are able to do quite a good job of that. As a naturopathic doctor, we are trained to be primary care physicians. We're trained at the level of being your family doc. Now, we have a very different view on things, but in that first visit, we schedule a whole hour. We may not need that whole time, but we schedule it so that you know that we've got the time to thoroughly review your personal history and family health history, the nature of your current concerns, what makes it better, what makes it worse, when did it start. We want to discuss your health goals, and we'll review your diet and supplements that you take, and perhaps also including the importance of the mind and body and spirit and how that may be affecting your health. So as a naturopathic doctor, we can look at the concerns our patients have and do some physical exam here in the clinic, briefly what we can in the office, and also talk about laboratory testing that we might do, whether it's of conventional testing, your blood tests, or a thorough thyroid panel, or perhaps the alternative tests like food sensitivities and hormone testing. So we can take the time to discuss what other information we might need. And we'll set a treatment plan that's based on your goals and that's appropriate to the starting point where you need to be. We can't always start with a super aggressive program for somebody who's not feeling very well and is very depleted. So we can tailor that to each individual. We'll discuss the diet and lifestyle, perhaps herbs or supplements that our patients need to take, and also talk about exercise and perhaps some other referrals for counseling or physical medicine that our patients might need. So in the first visit, with that time, we are able to develop quite an effective treatment program for our patients and determine also when we will follow up with our patients and set a schedule for how we want to evaluate and how we will go step by step in getting our patients towards their health goals. I think it's also important to keep in mind that we don't solve every problem on the first visit, but rather we look at the patient as a holistic individual, and we may choose or understand that some things are fundamental, may be affecting several of the patient's health concerns. And so tackling that means we don't have to address a treatment for each of the various complaints, but in fact there may be some underlying causes that will have a dramatic effect on a number of health concerns. So I hope that has answered your questions. I am Dr. Joe Clausen. I'm at Fish Creek Naturopathic Medicine, and I would encourage you to visit our website at www.fishcreek.ca if you have more questions. We would love to see you here at the clinic, and be well.